Good morning. I'm dressed for the occasion. Get to that in a second. Vicky's with us this morning. Thank you to Vicky for interpreting. Jay is not feeling well, so we're going to excuse him for the day. I know I'm looking quite a bit taller in the frame today, so I'm not opposed to this. So happy spring and happy opening day eve. The reason for the attire. I'm super excited as always. I remember standing here last year in this exact same outfit, celebrating the opening of Reds baseball season. So it was just a reminder to me at how long we've been doing this and how far we've come since then, because remember, we were pretty closed down last year at the time. So it's hard to believe that a year has gone by since we were in the midst of a complete shutdown in Hamilton County and throughout the country. It feels good now to be on the upswing. The weather, although the weather's supposed to be terrible tomorrow, but the weather is improving. And so I think we're all feeling fairly optimistic about what's coming, both by way of the red season and by way of vaccinations. So the vaccines are arriving. Greg, I know that you'll talk about this, but we are getting more and more vaccine into Hamilton County as we go, and that's the good news. More people are getting vaccinated than ever. We have vaccinated 236,232 citizens. They've all taken their first shot, and that's about 28.9% of the population. So just over one in. That said, more work needs to be done to reach all populations and help them get the shot, troubleshoot for them. Remember the website, testandprotectcincy.com. And if people don't have access to the internet, please call 211. There are live people there ready to answer your call and to help you navigate the system. So let me say this as clearly as I know how. Everyone needs a shot at getting the shot, and we're committed to that in Hamilton County. So today, the number of cases in Hamilton County, positive cases, stand at 76,271. The increase from last week, 697. Hospitalizations are at 2,809. Increase from last week is 51. And the number of deaths is at 1,151. Increase from last week, 21. In cases, as Greg Kesterman, the health commissioner for Hamilton County, has said, cases are plateauing here in Hamilton County. So let's keep working as a team to keep our numbers down in the spirit of opening day. Next, I'd like to take a moment to discuss the process for investments we will be making with that $159 million in federal dollars that's coming to Hamilton County from the American Rescue Plan. Our focus is now squarely on developing a 3-year plan that targets the county's top priorities and the community's needs. The following areas will form the building block of our investment to help Hamilton County build back better. Some of the categories include assistance to public health, help for families, whether it's rent assistance, mortgage assistance, food assistance. We're going to be listening to what those needs are for the families in Hamilton County. Job creation, budget stabilization, equity and inclusion, affordable housing, economic development, and community revitalization, and workforce development. So as you can see, the strategy here at Hamilton County is going to be understanding the immediate needs, as we did in the last round, hit those needs, make sure that we are using those dollars wisely, but really helping folks keep businesses open, keep families stable, reopen schools. That was the strategy last time. Remember, we had a deadline that was very short. This time, this round is rolling out in 2 different tranches, one 12 months after the first. And so we are waiting for Treasury guidance so that we better understand how we can spend the dollars. But we are going to have 2 buckets. One is kind of the emergent need bucket, which is what I just referred to. The second is more of a transformational, kind of visionary approach to these dollars to make sure that they're good investments. And so we're going to kind of be looking at this in two different ways. We have clear principles and a process to get to this plan. This will be a major focus of the Commission in the coming weeks. And the message to Hamilton County should be loud and clear: help is on the way. So in order to roll out the process, we are going to engage internally, but also engage some external partners that helped us in the last round figure out just where the community need was. And I'm going to give you an example of some of those external partners. The Urban League, United Way, the African American Chamber of Commerce, and the Regional Chamber of Commerce, the hospitality industry, local banks, small employers, the Municipal League, the Township Association, Human Services Chamber, Planning and Development. The list goes on, but it gives you a flavor of who we're going to be consulting. And then I have also asked the administration, give us the timing of this so that we can host public hearings. We really do want to hear from the public as to what they think the needs are and where they think we could best spend these dollars. And so that will likely be coming within the month of April or May. We do want to get this right, but we don't want to take too long. So we're going to have to make sure we're balancing out. But it is a great opportunity for the county, as was the last round. And so we're going to, again, try to hit the mark. And speaking of loud, and I did speak to that earlier in the statement, fans all over the country are going to be whooping it up tomorrow for opening. If you are coming downtown to take part in Cincinnati's most sacred of all holidays, come, enjoy, and let's do it responsibly. Wear your mask, wash your hands, keep your distance. Whether in the ballpark or outside in the new Dora, please keep your distance at the Dora, and let's work as a team to get this right. We do have Tim O'Connell. He's the VP of Ballpark Operations for the Reds. He's with us here today to talk about how different this opening day is compared to previous opening days. The Reds have worked really hard with the state of Ohio Public Health, city public health, county public health, leaders of the city and the county to make sure that we've got a plan that is exciting, but also recognizes that we need to do this response. And so in a minute, Tim is going to talk about how the Reds have adjusted, asked fans to adjust well, to make sure that it's a safe opening day. But before we get to Tim, we're going to go to Greg Kesterman.
Thank you, Commissioner. And good morning. I'm excited that our community continues to make progress on ending the pandemic here in Hamilton County. We continue to receive more and more vaccine week after week. Now more than 1/4 of our population is vaccinated. Today I'm going to start with some of the numbers. Over the last several weeks, we have seen numbers kind of plateau between 90 and 100 cases. I'd like to see that continue to come down because we are stuck at red with high incidence. But as you can tell, compared to where we were at in December at 716 cases per day, we're in a much better spot. So our average over the last 7 days was 90 cases per day. Continue to remember, particularly if you're getting ready to celebrate events or go to the Reds opening day or go to the Dora District, that there still is a lot of COVID within our community. There are over 3,200 cases of COVID in Hamilton County. Those are active cases and cases in which, if you're around one of those individuals, you do have the ability to get sick. So it's really important to continue to mask and social distance and do those prevention techniques that we've talked about throughout the pandemic. Following our cases is our reproductive number. It did drop down just slightly from where it was last week. We are at 0.94 for the county, and for the region we are at 0.91. So we are continued to be pleased to see this number crack below 1 part. Lastly, looking at our cases within our hospital systems, our 14 county hospital system has continued to see cases at a much more manageable level. Today we are at 158 patients within our hospital systems. In addition, we have 44 patients within our intensive care units. there are 34 patients on ventilators. We would like to continue to see these numbers drop, but certainly these numbers are at a level in which you need hospital care. The hospital systems are able to appropriately provide that care for you. Now moving on to vaccine, we continue to have 3 very highly effective vaccines available in Hamilton County. All of them do their job. They all prevent COVID. They all prevent serious illness as well as death. So we're very excited. We've had a lot of interest about all 3 vaccines, and we're continuing to get those vaccines out to the community as quickly as possible. Last week I showed a graphic. At the beginning of March, we were receiving about 14,000 doses. Now, when you include doses coming to Hamilton County Public Health and the other 50 providers in the county, our regional pod, as well as some of the Johnson & Johnson vaccine, we are seeing more than 45,000 doses of vaccine each week here in Hamilton County. This is huge, and it's making quite a difference. In addition, there are other regional pods in the area, including in Dayton and Wilmington, and I know many people have traveled to those, and that's very great news to see more folks out and about getting that vaccine. It's not a problem to travel to other communities if you're able to do so. As mentioned previously as well, if you are between the age of 16 and 18, you are now also eligible this week for vaccinations. It's really important, though, that you only schedule an appointment for the Pfizer vaccine. That is the only vaccine that has been FDA approved for individuals between 16 and 18. We, as mentioned, now have 1 out of 4 people in Hamilton County vaccinated. In addition, those over the age of 60, we've seen about 75% of them vaccinated. This is great news because we know that they are the group that has had the most serious illness from COVID-19. So we'll continue to track those numbers, and I'm very hopeful that we'll see more and more folks under the age of 60 get vaccinated in the coming weeks. Please, while we're waiting for more vaccine and more folks to have access to vaccine, please don't let your guard down. Continue to do everything within your power to make sure that you're keeping yourself safe, and that we continue to do things that will allow us to have more access to things outside and to activities. The best way to get through this pandemic continues to be wear your mask, social distance, and wash your hands. And please, if you have the opportunity to get vaccinated, I encourage you to do so. Thank you very much.
Thank you, Greg. Next, we have Tim O'Connell. He's the VP of Ballpark Operations for the Reds, and he's going to be talking about how the Reds have they're doing things differently this year to keep the fans safe.
Thank you, Commissioner Driehaus. Thank you for the time. Thank you, Vicki, for interpreting. Ladies and gentlemen, I cannot express to our community how excited the Reds are to welcome fans back. This has been an 18-month avenue that we have gone down in order to get us to where we will be tomorrow. Now, it's going to be a little bit different. We have spent the last 12 or so months working with our city, county, state health and government officials, our consultants with TriHealth, as well as St. Elizabeth and Michael Schuster Architects, in order to develop a plan that has been approved by all 3 health departments to bring back 30% of fans into a Great American Ballpark starting tomorrow. Our plan is based upon 5 pillars, and they're very simple. First of all, mandatory masks for everybody inside the ballpark, be it fans or staff. Secondly, social distancing from the time someone comes into the ballpark until they leave. We have put in social distancing measures. The most noticeable ones will certainly be the podding of up to 6 seats in the seating bowl, whereby each pod is 6 foot distance from the other pod. We have also implemented digital ticketing, where tickets are on your smartphone, as well as cashless pay, both of which have been designed to stop the transfer of money or tickets. The third one is personal hygiene. And not only will there be certainly restrooms available, but we're implementing hand sanitizing stations throughout the ballpark, on the concourses, at the elevators, other high touch point areas. The fourth one is cleanliness and sanitization. About a month ago, Great American Ballpark was awarded the GBAC Gold Star accreditation for cleanliness and sanitization. We also have partnered with P&G to utilize their microban product to sanitize the seats on a daily basis, all of which is designed to make sure that we're taking care of our number one obligation is that it's the safety of our fans. And finally, communication. You will see, and on the screen, you will see the new signage that will be throughout the ballpark. It is not red and white. It is purposely blue, green, and white in order to stand out. But the communication that we're having with our fans, both through the media, social media, through our signage, through our employees, all of which is designed to make sure that everybody understands what the expectations are, what the restrictions are, so that you not only have an enjoyable time at Great American Ballpark, but most importantly, you have a safe ballpark. I cannot say enough, again, about the cooperation, the guidance that we have received from our government partners, as well as our healthcare partners, as well as our architectural partners in developing this plan. And we are very, very confident that this plan will work. But if you're at the ballpark, you see something that does not make sense, come visit with us. Come visit with one of our employees or our fan accommodations desk, and we will make sure that if there is a problem, it will be corrected. Thank you, Commissioner, and happy opening day eve to everybody. Thank you.
Thank you, Tim. All right, Bridget, I think we're ready for questions.
Thank you, Commissioner. Corey Sharber from WVXU has questions for Greg.
Good morning, Corey.
Good morning, Greg. Happy opening day eve. Obviously, it's a big event for all of Greater Cincinnati and Hamilton County. But of course, there's been a lot of concerns brought up with the new DORA. There's been photos circulating of a lot of people gathered, not socially distanced. What concerns does all of this bring up, especially with cases plateauing? Are you guys paying attention to this and trying to see if there's any ways to make changes to it?
So a couple things to keep in mind. The jurisdiction where the DORA is within the city of Cincinnati, so ultimately they would have regulatory authority. But from a high-level perspective, I'm certainly concerned. I really want to make sure that Hamilton County continues to go in the right direction with regards to the metrics that I just went through: hospitalizations, cases, and intensive care unit admissions. Right now, I have no reason to be concerned because they're not increasing. However, I do want to continue to see them decrease, and I know that the more that we come together and let our guard down, the greater opportunity there is for us to increase COVID activity within our community. So my plea with everyone is, while it's wonderful to be outside, while it's wonderful to get activities back together, we all have to play a role to make sure that Hamilton County can get things back to normal.
And of course, there's also been reports of a new variant popping up within the state of Ohio. I was wondering if that has managed to pop up in Hamilton County, and just give me an update on the variants within the county at the moment.
So I believe in Hamilton County, there's a few cases of the variant within my jurisdiction, as well as some cases within the city of Cincinnati jurisdiction. I believe the only two variants are the California variant as well as the UK variant. And I've been saying for many weeks now, this is not a surprise. Once these variants entered the United States, they're very easy to spread. The good news, though, as I keep reminding folks, the prevention methods that we've been talking about throughout this pandemic for more than a year are the same tools that we will use to combat the variants. In addition, everything that we've seen scientifically tells us that the vaccine will be effective against the variants.
You're only seeing one case of each of those in the county, right?
I believe the city of Cincinnati has several cases, and I don't know the breakdown. In our jurisdiction, I believe we have 2 cases of the UK variant and 1 case of the California variant.
And of course, speaking of that and cases plateauing, is testing still being at the same level as it was previously, or has there been any changes in that amount?
So over the last month, we're seeing about 100 tests per 100,000 people. Back in December, we were seeing closer to 200 and 215 tests per 100,000 people. So we have seen a decrease in testing. I think one of the things to keep in mind, though, is if folks aren't feeling sick, they're less likely to get tested. And I think that's acceptable. The message, though, is really important that if you are feeling sick, there is still great access to testing here in Hamilton County through Test and Protect. And so I would encourage folks to get tested. Insurance is not required. If you don't have a means to pay for testing, it's free. Get a test done here in Hamilton County, better than anywhere else in the state of Ohio.
Thank you very much.
Thanks, Corey.
Thank you. Molly Lair from WLWT has general questions for either commissioner.
Both of my questions were related to DORA and variants, so I don't want to make you rehash what we've really already discussed.
Thanks, Molly.
Thanks, Molly.
Next up, we have Chris Wederick from the Business Courier. He has questions for you, Greg.
Hey, good morning, Greg. Can you be a little bit more specific in terms of how many vaccine doses we've received? Is it more or less than last week? And do you have can you pinpoint a number?
Sure. So it gets vaccines come from a few different sources. Vaccines that are coming straight from the state of Ohio to the 50 providers, I have a very clear number of doses. So last week we received, as the 50 providers in Hamilton County received 26,000 doses. This week we are receiving 30,000 doses direct shipment from the state of Ohio. In addition to those doses, we know the federal government is providing doses to many pharmacies, including Kroger pharmacies throughout the county. That number is most likely in excess of 6,000 doses. And then finally, there are also doses coming from the state of Ohio for the regional pods, like at the Cintas Center, and I believe that number to be greater than 10,000 doses. So the number I referenced earlier was about 45,000 doses coming to Hamilton County in total this week.
Thank you, Greg. That's all I had.
You're welcome.
Okay, and that appears to complete our questions from reporters.
Wow, that's an easy morning for the rest of us. Thank you. Yeah, and thanks again to Tim O'Connell for being here. We really appreciate the update on what the Reds are doing for opening day. Greg, as always, thank you for being here. You know, for those of you celebrating Easter or Passover, we're going into a lot of holidays here, a lot of potential gatherings here. Just a reminder, just like with the Reds opening day, just like with the Dora, there's a way to be safe and celebrate at the same time. So let's be safe out there, and we'll be back next